slouch forward. Any pain in the lower back or stretching in the leg? Where about? Where do you feel the pain? On the right side. Okay. Any pain in the lower back? No?
Lightly.
Which side? Right side.
Ah.
You start to feel it? All right. Where about?
Right.
In here or lower down?
Lower down.
Yep. Yeah,
Now,
yes.
where about?
Yes. Am I right?
In your lower back.
Yes.
Is the glute max. Now, what I'm doing is I'm directing the needle towards the pathway of the sciatica. How's that?
Strong.
Too strong? Neural impulse adjuster. Go. Inhale, exhale.
Oh!
Nice. Inhale, exhale. Okay. You good?
Yes.
What's up, everybody? Dr. Ranen here. Today I'm with Danielle. Danielle is a competitive bodybuilder and personal coach based in Dubai. Today she comes in with lower back pain and referral into the right buttock, hamstring, and calf. It started about 4 months ago after doing a deadlift, and her symptoms are not improving. It's worse when deadlifting, squatting, and doing Romanian deadlifts. So we're going to get her assessed, see what's going on, and see what treatment we can provide for her. But before I get into it, make sure to like, subscribe, and hit the notification button. All right, let's go. Okay, leave your leg loose for me. Let's get you to cross your arms for me, please. Like this. Pull apart and look up. There we go. There we go. That's a little trick. We call that the Giandrastic maneuver. Relax for me. Great. Okay, you can relax your hands. Can you feel that?
Yes.
Same both sides? Yeah. Here, same both sides.
Yes.
Here,
Yeah.
same. All right. Here, 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 same. Okay, lift your toes up for me, please. Both sides. Your toes, like this. Tough, more difficult on the side. Push up, 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 up. Lift your foot up. There we go. Push, up, 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 up. There we go. Just hold. Hold it strong. Push. Okay. This side. Can you lift your toes?
This is second.
This side you can't. All right. It's also important to note right now that Danielle is experiencing edema post-competition after maybe a bad, what's the process called when you start eating again?
Yeah, because of the salty, guys.
Yeah.
I eat some salty after of my competition. I just having a meal like so bad for 2 days, and it's happened this
There
time.
you go.
Salty,
Yeah.
guys.
What's the process called when you need to start eating well again?
So we have to get for the processing for clean eat again.
Yes.
So to get back again for our hormone to go
Okay,
there.
great.
So I
Well,
just eat it.
Danielle didn't quite follow that process well, so
Yes.
that's why she's really struggling here. She's got some edema. We've already looked at it. This is not something which I will be addressing. She's already seen a physician and she's got that under control. But you can see what a difference it's making in a motor function on this side, okay? But the problem's in this leg, so we're gonna continue our testing. Can you bend your toes down here for me? Bend it down, your toes like this. All right, push down, push, 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 push. Great. Lift your toe up again. Push up. Push hard as you can up. Go. Okay. All right. Straighten your left leg for me, please. Your left. Lift it up. Yes. Point your toes towards you. Drop your chin down. Slouch forward. Any pain in the lower back or stretching in the leg? Where about? Where do you feel the pain? On the right side. Okay, relax. Straighten the right leg. Point your toes towards you, chin down. Any pain in the lower back or stretching in the leg? Where about? Right side. Okay. Let's get you to stand for me, please. There we go. You're going to face that way. Okay. Any pain in the lower back? No?
Lightly.
Which side? Right side. Okay. Any pain in the lower back? Right side. All right. Any pain here? No. Any pain here?
Yes.
Right side. Okay. Place your hands on the bed for me, please. Bend forward. Slowly stop as soon as you get any pain in your back.
Ah.
You start to feel it? All right. Where about?
Right.
In here or lower down?
Lower down.
Lower down here. Anything in the back? No. Continue to go. Go, 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 go. Nothing in the back. All right, great. Let's get you to take a seat for me. On your back for me, please. All right. Let's start with the left leg. Okay. Relax your leg for me. Any pain in the lower back? No. Okay. Leave it loose. Any pain in the lower back? Yes? Where about? All right. As soon as you start to feel it, let me know, okay? There we go. Leave it loose. Leave it loose.
Yep. Yeah,
Now,
yes. I
where
feel the
about?
pain. Yes. Am I right?
In your lower back?
Yes.
Okay. There we go. All right. Let's do some muscle testing. Okay, so we're just going to test your quads, your psoas, just to see how they're functioning, all right? And compare them to the opposite side. Can you raise your leg for me? Hold. Okay. Can you push up? Yes, go. Okay. Turn your foot out for me. Push diagonally. Yes, push across. Push hard as you can. Push. Okay, relax. So we're obviously going to have some issues with this leg because of the edema. The lower leg is still quite swollen. But it's always good to get a comparison when doing muscle testing. This is her affected side. The edema in this leg is much less, almost completely none. So we'll get a good idea as to whether it's actually firing as it should. Lift your leg for me, please. Push up for me now. Push hard as you can. Not bad at all. There we go. Turn your foot out. Push diagonally. Across. Yes, go. Go, go, go. Hard as you can. Fantastic. Relax. Okay. Push across for me. Inward, inward. Push in. Great. Relax. Keep your leg in this position. Push inward for me. Go, go, go. Great. Fantastic. Okay. Let's get you face down for me, please. Okay, so that is L4. All right. Any pain when I push on here? Yes?
Yes, yes.
Okay. Any pain when I push on here?
Oh, yeah.
Yeah, more. Any pain when I push on here?
Yes.
Yes, okay. Which one is most painful? 1, 2, 3.
3.
3,
The
okay.
three.
So what we do is we look for the iliac crest, and then we come across. The iliac crest is at the level of L4. So I mark off L4. Then I feel for the next spinous process, which is L5, and I feel for the next one, which is S1. When I push on to the bone, I'm kind of trying to get an idea if there's any tenderness or sensitivity at that level. It will help me to correspond any deficit in the nervous system that I have previously assessed in the beginning of my examination. It helps me to put a complete the puzzle, essentially. All right, in a puzzle in the diagnostic process. Okay, let's have a look here. So we have a slight short leg here on the right side. Okay, can you raise your right leg from your hip for me? From your hip, like you're doing from here, from your hip. Yeah, can you lift up? Okay, and down. Opposite side, can you lift up? Okay, so we can see the difference between right and left. There's my pen right here. Okay. Which side is more sensitive? Right or
My right.
right is more sensitive? Left? Not so much.
Not so much.
Okay, so even though she has more hip extension on the right side, which would indicate in this case no dysfunction of L5S1, she's having more sensitivity here. So we'll mark it. After we do some treatment, we'll reassess and we'll see if there's a difference in hip extension and sensitivity here. Any sensitivity here? Which side?
Right.
Right. Okay, so sensitivity at the sacroiliac joint as well. And that's also in keeping with our hip extension test. When the hip is extended and it is lower than the opposite side, it generally means a dysfunction of L5S1, which is what we were expecting. When the side is higher, it means dysfunction of the sacroiliac joint. So that confirms that orthopedic test. Okay. So we're going to get into some treatment now. I'm going to decompress the disc, do some intramuscular electro stimulation, stabilize the segment between L4 and S1, do some reassessment, and see how Danielle feels. You okay, Danielle? We're going to do some treatment for you now, okay? Okay. Just relax your back muscles for me. There we go. So what we're doing now is we're using Cox flexion distraction technique to decompress the disc. This is a fantastic way, or fantastic technique rather, that chiropractors use in management of the disc injury. Now I know she has a disc injury, whether it's a sprain of the disc, a disc bulge, disc herniation, because when we conduct our neurologic examination, she has motor deficit in her toe. She can't really lift that toe up too much. She had positive nerve root compression tests on the right side. And when we moved her to the left, she starts feeling pain on the right. Get her to bend forward, she's feeling pain in the leg. So these are some of the things that I look for in my assessment of a patient. What I'm doing here is I'm using a neural impulse adjuster. This tool is commonly used to perform a manipulation in cases where you can't actually perform a manual manipulation. Even though I can manually manipulate, what I do with it is I use the impulse that it produces to fire up the muscles that are stabilizing the disc. How my treatment works is I want to do layers of therapy. Each layer needs to feed into the next. The more layers I have, the more profound the effect of treatment for the patient. You okay? There we go. Last round. Okay, Danielle, you want to turn to your side and sit for me, please? Ooh. You can sit, yeah. When you're moving, try to, if you're lying on your face, turn to your side and then sit up, okay? When you're lying face down, yes, turn to your side and then sit up. Don't just wake up like how you did. You're going to put tension on the disc. It's the same it's the same thing when you're at the gym. If you're doing some stretching on the floor, be cautious about how you move. All right? All right. Let's get you to pop your track pants off for me, please. Okay. Lift your legs for me. Lift both of them. There we go. Okay, so what we're going to do today with the intramuscular electro stimulation, those of you who have been watching my channel will know that I use that technique to desensitize or decrease sensitivity of the sciatic nerve. Those of you who are new to the channel, this explanation is for you. Essentially, what I'm going to do with the dry needling is place needles along the pathway of the sciatic nerve or certain branches of the sciatic nerve. By decreasing the sensitivity of it, we can reduce the tension in the hip joint, reduce some of the irritation, feeding back to the lower back. So we're going to start off here. This is for the posterior femoral cutaneous nerve. This is the glute max. Now, what I'm doing is I'm directing the needle towards the pathway of the sciatic nerve. This is for the glute med, directed into the glute med, but it's going to target what's called the medial cluneal nerve. This nerve gives pain along the sacroiliac joint. So often patients that are having nerve compression will complain of pain on the joint. Therapists often describe that as sacroiliac joint syndrome, but the sacroiliac joint is a very tight, fibrous joint. It's difficult for it to go out of alignment, so to speak. What I have found is that it's mainly due to irritation or sensitization of the medial cluneal nerve. All right, this is going into your glute min. Now, the reason why I do glute min is inadvertently, even though I'm desensitizing the medial cluneal nerve here, it's going to fire up the glute med muscle. What I want to do is I want to fire up glute med, glute min. This provides good stability to the hip. So I always do this combination stimulation in a patient experiencing sciatica or sensitivity over this area. So Danielle, we're going to do an electrostimulation. What you're going to feel is a pulsation of the muscle, okay? All right. It should be light to mild. If it's too strong, let me know, okay? All right. Okay, guys, remember, like, subscribe, hit the notification button. You don't want to miss these videos. Can you feel that?
Yes.
Light, mild, or strong?
Light.
There we go.
Strong.
Too strong? Okay, now better? Okay. Oh, there we go.
Strong.
Too strong?
Yeah.
Now better?
Yeah.
How's that?
Strong.
Too strong? Okay.
This is.
Too strong?
Yes.
How's that?
Now fine.
Good?
Yes.
Okay. Okay. So patients often ask, what is the difference between the two stimulations? This is a more high frequency, short duration stimulation. I use it as a way to open up the neurologic pathways, and this device produces a lower frequency, more long duration stimulation. I use this to solidify and maintain that neurologic pathway that I've just opened up. You feel that?
Yeah.
Light, mild, or strong?
Strong.
Too strong? Now
Now better.
better? Okay. This will run for 5 minutes. If it gets too strong, let me know, okay? Can I increase the strength?
Yes.
How's that?
Okay.
It's okay?
Yes.
So we're doing our intramuscular electro stimulation now for the sciatic nerve. We still need to do a few things to solidify this stimulation. We also need to do some electrostim on the lower back to fire up those muscles that are supporting the disc and offload the nerve or the nerve that's being impinged. What we would do with someone like Danielle moving forward is, after we break down this pain pattern or pain cycle she's having in her leg, we'll start with exercise rehabilitation. Generally it takes within 2 to 3 sessions. We'll assess her, look for any incorrect movement patterns or dysfunction in her movement patterns, and start exercise rehab to improve those movement patterns. For the meantime, she'll probably avoid those painful movements such as deadlifting, squatting, and Romanian deadlifts. You may be asking why those three particular exercises. These are very common exercises which cause irritation of the discs and lower back. Why? Because L4, L5, and L5S1, they form the foundation of the spine. They form a big connection with the pelvis and the sacrum, and they take a significant amount of load in inflection or hip hinging. So any dysfunction in movement pattern is going to overload that joint, overload the disc, and result in an injury. You guys are probably wanting to know, how did I come to my diagnosis? And what is the diagnosis? Is it a sciatica? Is it lower back pain? Is it a lumbar radiculopathy? What are the differences between those three? Lower back pain is lower back pain in its own. It does not have any referral into the leg. Sciatica is pain only in the leg. And a lumbar radiculopathy is lower back pain associated with pain in the leg. And that's what Danielle is having. So the reason why I'm working on the sciatic nerve is because this is one of the most commonly affected nerves. But don't confuse what I'm doing and associate it with sciatica. Okay, two different injuries, but the nerves that are affected are pretty much the same. Okay, so we're gonna pop off our needles now. You okay, Danielle?
Yeah.
All right. So in the beginning, or a little earlier on in the video, you would have remembered I said I'm trying to layer my treatment. So we've done our electrostimulation. Now I'm going to use a percussion massager. And what I'm going to do with the massager is I'm going to move from the furthest part of the nerve all the way to where the nerve inserts. You see that as soon as I get over the sciatic nerve here in the deep gluteal muscles, she starts to feel pain. Now, I'm not pushing very hard. I'm not pushing at all. I'm just running the device over the skin. This is what we call centralization of pain. If we push the pain back, or the painful stimuli back towards the spine or the spinal cord will be able to deal with it more. Now, why is Danielle having pain while I'm doing this? Am I pushing hard, Danielle?
No.
No. So the question is why? It's very simple. The sciatic nerve gives off branches that go to the skin. When you have irritation of the nerve itself, you're going to have irritation of the skin. So again, if I can attack each layer of the injury, I'm going to have the most profound effect on the patient's pain. It's worse there, eh? Yeah. All right. So now what we will do is our electrostimulation in the lower back. Okay. You okay? Oh, got a small twitch there. You okay? So you can see how hypertonic the muscle is. Hypertonic means the muscle is very, very tight. Okay. You good? Try and relax your body for me. Drop your body into the bed. There we go. We have one more to do and then we're done. Fantastic. Let's hook you up. Can you feel that?
Yeah.
Light, mild, or strong?
Light.
Light.
Right.
Too strong?
Yes.
Better now?
Better.
Okay. So you may be wondering, what is the difference between dry needling and what I am doing? Both techniques use the acupuncture needle, but dry needling is more designed to treat myofascial trigger points or muscle knots. The needles are inserted into the knot itself and moved a few times. This produces a twitch response, which facilitates a chemical reaction, a physiological reaction in the brain to send more healing cells to that area to repair the muscle. With intramuscular electro stimulation, I am using the needle to insert through the muscle, but I'm directing the needle strategically to certain nerves. You can use intramuscular electrostimulation and direct the needle to specific muscles to stimulate that muscle, which is what I did when I worked on the glute min here. But in this case, what I'm doing is I'm targeting a specific nerve. In this case, it's the posterior branch of the medial spinal nerve. What that's going to do is it's going to give feedback to the spinal nerve, try and reduce the lower back pain, try and reduce the nerve sensitivity, nerve irritation, sending pain down the leg. It's also going to fire up the muscle stabilizing the discs, in particular the multifidi muscle. The multifidi and the transverse abdominis are responsible for, well, there are two important muscles that are involved in core stabilization. You have your transverse abdominis in the front, your multifidi at the back, your internal and external obliques, and your pelvic floor. So if we can fire up the multifidi, we inadvertently are going to fire up the transverse abdominis, and this is going to help to stabilize the disc and the lower back. You good, Danielle?
Yes.
All right. How's that?
Strong.
Too strong? It's okay?
Yes.
So how long have you been bodybuilding for?
I just did that for my bodybuilding for this year, 1 year.
Bodybuilding for a year, okay. And you've been a personal trainer for how long?
4 years
4 years.
in Dubai.
All right. 4 years in Dubai, and how many years back home?
No, from my back home, no.
You weren't a PT
Yes.
back home. All right. Great. Are you enjoying being a PT and competing?
Yes.
Yeah.
So good.
So when will be your next competition?
After recondition of my 5 months.
After you recondition. Okay. And what show will that be?
It will be the same on bikini competition again.
Bikini competition. Any particular event?
Particular event, we'll check where's the show.
Okay.
We prepare first to recondition and we will pick the show.
Okay, great. And who's your coach?
Coach Jamie Rabilon.
Jamie who?
Rabilon. Jamie.
Jamie Ravido.
Rabilon.
Ravindran.
Rabilon.
Rabilon.
Ravilo.
Jamie
Coach
Ravilo.
Jamie.
Okay. Which gym does he train out of? Same gym as yourself?
No.
Okay. Can we increase the intensity?
Yes. Okay.
How's that?
Yeah.
It's okay?
Yes. Yes.
Okay. All right, we'll reduce it a little bit. Okay, you just have 40 seconds left. All right, let's get these out. Oh, we got a small twitch there. You okay? Okay, let's reassess here. All right. So before I manipulate a patient, I always like to reassess some of the parameters that I investigated before, just to see if there's been a change. So we're going to go ahead and check leg length. As you can see, leg length has improved. Okay. Why is this? Well, by decreasing the sensitivity of the nerves that are switched on and on fire, improving the stability of the lower back, firing up some of the pelvic stabilizing muscles, you're going to have a change in mechanical function. So it's always good to see what's working, what's not working, what more you need to do to get the patient where they need to be. All right, let's get you to raise your right leg from your hip. Okay, you see already how much that has changed. And down for me. Left leg. There we go. Great. Relax. All the way down. Okay. Any sensitivity there? Any sensitivity there?
Yes.
Yes. Which one is more sensitive? Right side. Okay. Any sensitivity here?
Oh.
No.
Yes.
Which side?
Both.
Both. Okay. Which one's worse, right or left? Left. There we go. So, as you can see in the beginning, we had a little bit of confusion. She had a left passive hip extension test, which was positive, which means that the L5 facet joint needed to be manipulated, but she was experiencing more sensitivity here. After we desensitize, we can see exactly where the problem lies, and it's of course more sensitive on the left side. So we're going to go ahead and do some manipulation now, and then do some nerve flossing on this leg. All right, let's get you to turn to your side for me. Please face this way. Okay, lift your head for me. Great. Okay, come down for me. Come down, come down, come down. There we go. Right, turn to your side now. Lift your head up. There we go. Great. Bring your hip to the edge for me. There we go. Straighten your bottom leg. There we go. Right. Great. Give me this hand. Look up for me, please. Turn your head. Look up at the ceiling. Great. Inhale. Exhale all the way out. Oh, one more time. One more time. Inhale. Exhale all the way out. Okay. Let's get you to turn that way for me. Come to the edge for me. Great. Bend your top leg, straighten your bottom leg. You good? Yeah? Give me this arm. Okay. Lift your head up. All right, let your knee roll, drop down. Oh, there we go.
Born.
Popcorn. Inhale. Exhale. All the way out, all the way out.
Oh,
There we go. You good?
it's long time I don't do this.
Since a long time.
Oh, no one, no
Sit.
one pop around with me like
Sit,
this.
sit for me. There we go.
Very stressed person.
You're a very stressed person.
Yes.
All right, well, we're spoiling you today with some recovery. Okay, come to the edge for me. Come to the edge. Great. Lift your, cross your arms, lift your head for me, please. Lift up, up, up. No, this way. There we go. Right, leave your body loose, okay? Leave your body loose. Inhale, exhale.
Oh.
There we go. Inhale, exhale.
Oh.
Nice. Inhale, exhale. Okay. You good?
Yes.
You needed that.
Oh, I really didn't need this one, guys, actually. For such a long time, no, never. And never ever I did that. Someone gonna pop this one be like.
On your back for me, please.
Yes.
On your back. You know, just lie back. There we go. Okay. All right. So, leave your leg loose. We're just going to floss the nerve. You okay? All right. So, the final layer of my treatment for sciatica or a lumbar radiculopathy or any type of radicular pain is to floss the nerve. What we're doing here is moving the nerve back and forth wherever it is impinged. Leave your leg loose. And that's going to mobilize the nerve and reduce the tension on it. Okay, relax for me. Leave your leg loose. Leave it loose. I'll lift it, okay? Any pain now? Nothing? Nothing at all? There we go. Okay. Sit for me, please. Swing your legs over. Face that way. Okay. Straighten your left leg for me. Relax. Chin down. Slouch forward. Any pain in your lower back? Nothing.
Nothing.
Relax. Straighten. Any pain in the lower back? Nothing.
Nothing.
Great. Okay. So, I think the most important test that I will do is to retest motor function. So, when the nervous system is compromised or there's a dysfunction in it, when we're doing our assessment, it's very important that we retest these findings. Even though her pain has improved, I'm very happy, but I need to ensure that the motor function has improved or any other neurologic deficit for that matter. That's going to tell me I'm on the right track. It's going to tell me what needs to be worked on more in the future. Let's get you to lift your toe up for me, please. Already, immediately you can lift the toe up better, correct? Yeah? All right, push up for me. Look at that. Much better. Okay, guys, so that brings an end to our session today with Danielle. Do you want to tell our viewers where they can find you on social media?
Hi guys, you can find me on social media and Instagram, and it's me Barbilita, and I was a personal trainer and TYV transformed by Yasserkat Alcus Industrial Clinic.
There we go. All right, guys, make sure to like, subscribe, and hit the notification button. We'll see you soon. Cheers. All right. If you have any questions or suggestions on topics that you may want us to discuss, please drop them in the comments section below.